The endocrine system. The endocrine system is composed of glands that secrete essential hormones into the bloodstream to regulate body processes like metabolism, growth, fluid balance, and reproduction. Major glands include pituitary, master gland at brain base secretes hormones influencing thyroid, adrenals, ovaries, testes. Pineal secretes melatonin influencing sleep cycles. Thyroid, large gland in neck secreting thyroid hormones regulating metabolism. Parathyroids, 4 tiny glands on thyroid controlling blood calcium levels. Thymus, mediates immune system function. Adrenals, pair of glands atop kidneys. Outer adrenal cortex regulates carbohydrates and circulating blood mineral levels. Inner adrenal medulla secretes catecholamines like epinephrine. Pancreas, regulates blood sugar with insulin and glucagon secretions. Ovaries and testes, sex glands secreting reproductive hormones like estrogen, progesterone, and testosterone. Disorders can occur if glands produce too much or too little hormone, resulting in abnormal physical and mental functioning. Nurses play key roles diagnosing and managing endocrine problems. Diabetes types. Diabetes mellitus causes abnormal elevated blood glucose from inadequate insulin levels or effectiveness. 2 main types include Type 1. Autoimmune destruction of insulin-producing pancreatic beta cells causes complete lack of insulin, necessitating injected pumped administration to regulate blood sugars. Usually develops in childhood, but can occur at any age. At higher risk for ketoacidosis if untreated. Type 2. Develops over many years of insulin resistance, with partial pancreatic cell failure, unable to meet demands of obesity aging, resulting in hypoglycemia. Managed with oral medications, diet, exercise, and later possible supplemental insulin therapy if pancreas function further declines. Most common type, representing over 90% of cases. Both types lead to micro and macrovascular complications if prolonged elevated blood sugars are left unchecked. Careful glucose monitoring and control can prevent or slow damage progression. Hyperglycemia versus hypoglycemia. Hyperglycemia refers to abnormally high blood sugar, generally over 180 mg per milliliter, depending on various references. Symptoms correlate with elevated glucose levels and include mild, thirst, headache, blurred vision, frequent urination. Moderate, fatigue, nausea, rapid breathing. Severe, vomiting, abdominal pain, fruity breath, impaired mental function. Hyperglycemia refers to low blood sugar, generally below 70 mg per milliliter, depending on references used. Signs may include mild, palpitations, tremors, sweating, hunger. Moderate, confusion, improper behavior, incoordination. Severe, loss of consciousness, seizures. Both hyper and hypoglycemia can be life-threatening emergencies without swift interventions to stabilize blood sugar. Insulin types. Various types of injectable insulin are utilized in management of diabetes based on their pharmacokinetic profiles, including rapid-acting, Lispro, Aspart, glucosine insulin, 15 minutes onset, 2 to 4 hour duration. Short-acting, regular insulin, 30 to 60 minute onset, 5 to 8 hours duration. Intermediate-acting, NPH insulin, 2 to 4 hour onset, 10 to 16 hours duration. Long-acting, glargine, detamir insulin, 1 to 2 hour onset, 20 to 26 hours duration. More concentrated formulations allow smaller volumes for pump infusion pen devices. Combination products mix rapid or short insulin with intermediate forms for improved coverage across meals over 24 hours. Thyroid gland disorders. Thyroid disorders include hypothyroidism. Underproduction of thyroid hormones causes fatigue, weight gain, hair loss, and sensitivity to cold. Replaced with oral levothyroxine. Hyperthyroidism. Overproduction of thyroid hormones causes anxiety, palpitations, heat sensitivity, and weight loss. Treated with antithyroid medications, radioactive iodine, or surgery. Thyroid nodules masses can be benign fluid-filled cysts or malignant tumors like papillary carcinoma, requiring biopsy, surgery, and treatment. Goiter, diffuse enlargement or swelling of thyroid gland, may be related to iodine deficiency or autoimmune inflammation. Graves' disease, autoimmune hyperthyroidism with diffuse goiter and bulging eyes. Thyroid gland issues range from inconvenient symptoms to life-threatening thyroid storm triggered by infection, stress, or medication non-compliance in severe untreated hyperthyroid patients. Careful long-term monitoring and patient education on thyroid dysfunction is essential. Parathyroid gland disorders. 4 tiny parathyroid glands reside on backside of thyroid gland, regulating blood calcium via parathyroid hormone, PTH, secretion. Disorders include Hyperparathyroidism. Overproduction of PTH causes elevated blood calcium, hypercalcemia, resulting in mental status changes, abdominal pain, kidney stones, bone fractures, and milk alkali syndrome, with calcium deposit buildup throughout the body. Surgical removal of overactive glands may be curative. Hypoparathyroidism. Parathyroid damage, destruction with insufficient PTH leads to decreased hypocalcemia, with signs like muscle spasms or tetany and poor concentration. Supplemental calcium and activated vitamin D can stabilize levels long-term. Adrenal cortex disorders. Outer adrenal cortex hormones include glucocorticoids like cortisol regulate protein-carbohydrate metabolism and anti-inflammatory immune response. Mineralocorticoids like aldosterone control sodium-potassium blood levels, influencing blood pressure volume. Pathologies include Cushing's syndrome. Hypercortisolism from pituitary or adrenal tumors causes central obesity, moon face and buffalo hump. Diabetes and hypertension result. Treatments aim to curb cortisol production action. Addison disease. Autoimmune primary adrenal insufficiency with life-threatening cortisol-aldosterone deficiency causes fatigue, weight loss, and low blood pressure. Cortisol fluid replacement stabilizes. Congenital adrenal hyperplasia. Recessive genetic disorder with missing, defective enzymes impairing cortisol synthesis. Virilization of female genitalia may occur from prenatal androgen excess. Glucocorticoid therapy supplements hormone levels. Pituitary tumors. The master pituitary gland oversees hormone regulation of key endocrine glands. Functional pituitary tumors can result in hormonal hyper or hyposecretion. Prolactin-producing tumors, lower sex hormones causing amenorrhea, impotence. Growth hormone excess causes gigantism in youth or acromegaly if adult onset. ACTH-producing tumors trigger excess cortisol manifestations of Cushing's. Non-functional tumors compress nearby pituitary cells, disabling normal hormone output. Thyroid adrenal insufficiency, infertility, visual disturbances if pressing optic nerves. Medical therapies, radiation and transsphenoidal surgery help manage issues related to pituitary disorders, restoring homeostasis.